Ever experienced a constant ringing or buzzing in your ears that simply won't go away? That could be tinnitus, a common auditory issue that affects millions worldwide. It's not just an annoying sound. For many, it's a daily struggle that can affect sleep, concentration, and overall quality of life. But there's light at the end of the tunnel. Recent years have seen a surge in both traditional and modern treatments, offering new hope. So, stick around as we explore the world of tinnitus treatments. In the past, tinnitus treatments primarily aimed to manage the symptoms. To understand this better, let's discuss the three main traditional approaches, starting with sound therapy. This method uses external sounds to alter the perception of tinnitus. Sound-based therapies involve four modalities of action: masking, distraction, habituation, and neuromodulation. It could involve white noise machines, hearing aids with built-in masking features, or environments enriched with sounds. By drowning out the tinnitus, sound therapy can provide temporary relief. The second traditional treatment is counseling and education. Understanding the condition can help those affected by tinnitus cope better. Through counseling, patients can learn different strategies to deal with the psychological aspects of the condition. These strategies may include relaxation techniques, cognitive behavioral therapy, or mindfulness exercises. Mindfulness-based stress reduction is a therapy that emphasizes mindfulness, an acute and non-judgmental awareness of one's physical sensations, sensory perceptions, emotional reactions, and cognitive processes. Rather than struggling, often in vain, to ignore tinnitus, MBSR teaches patients to wholly accept, embrace, and control their experience. In doing so, patients put themselves in a better position to manage their condition. It can also address negative feelings of anger and apathy that so often accompany tinnitus. In tinnitus retraining therapy, emphasis is placed on education and how the brain is involved in the perception of tinnitus. This can help you to understand where tinnitus comes from, as well as the reactions produced by other mechanisms in the body in response to tinnitus. The goal of TRT is to gain knowledge and understanding of your tinnitus, and for you to have more control over your emotions and reactions to the tinnitus. Ultimately, you will place less importance and priority on the tinnitus, which in turn will help you cope with the tinnitus more effectively. Sound therapy is a vital component of TRT, providing a combined solution for proper tinnitus treatment. Progressive tinnitus management is similar to TRT regarding education, but it tries to customize the therapy according to the solutions that work best for each patient, hence a more active role of the patient is required. It uses a 5-step hierarchical approach that addresses the needs for different levels of tinnitus. PTM highlights how unique tinnitus can be to each person and strongly emphasizes the use of sound, in combination with counseling. Next, we have medications. Even though no drugs directly target tinnitus, some can help alleviate related symptoms. For instance, certain medications can reduce anxiety or insomnia that often accompany tinnitus. This indirect approach can improve a patient's overall quality of life and make the condition more manageable. Some research indicates that deficiencies in certain vitamins and minerals, like magnesium or zinc, may be linked to tinnitus. Supplements could be beneficial, although it's important to consult with a healthcare provider before starting any new supplement regimen. Earwax removal. Sometimes a buildup of earwax can exacerbate tinnitus. Professional removal of earwax can help in reducing tinnitus symptoms. Treating sinusitis and allergic rhinitis can play a significant role in managing tinnitus, particularly when these conditions contribute to the patient's tinnitus symptoms. Allergic rhinitis and rhinosinusitis can impact the ear and contribute to conditions that exacerbate tinnitus. Additionally, other therapeutic options have been used for tinnitus treatment like acupuncture. This traditional Chinese medicine technique involves inserting thin needles into specific points on the body to balance energy flow. Hypnotherapy aims to change the perception of tinnitus through relaxation and suggestion techniques. It can help reduce the stress and anxiety associated with tinnitus. Dietary changes. Some individuals find that reducing the intake of certain foods and substances like caffeine, alcohol, and salt can alleviate tinnitus symptoms. A healthy, balanced diet may also contribute to overall wellness and symptom reduction. Physical therapy. If tinnitus is related to temporomandibular joint (TMJ) disorders or neck strain, physical therapy can be an effective way to address these underlying issues. These traditional methods have been the cornerstone of tinnitus management. They've provided relief and support to many people, helping them navigate their daily lives with less discomfort. However, these treatments often focus more on managing the symptoms rather than addressing the root causes of tinnitus. They're like putting a band-aid on a wound. They can cover it up, but they don't necessarily heal it. Today, we see exciting new developments in tinnitus treatments. Let's explore some notable advancements that are reshaping our understanding and management of tinnitus. First up is Transcranial magnetic stimulation, or TMS. This non-invasive method uses magnetic fields to stimulate nerve cells in the brain. The magnetic fields can potentially modulate the brain's auditory processing, offering a new approach to addressing tinnitus at its root. While primarily used for depression treatment, its application for tinnitus is still considered experimental. However, the American Tinnitus Association acknowledges its potential in reducing tinnitus symptoms. Next, we have Bimodal Neuromodulation. This treatment combines auditory and somatosensory stimulation. For instance, a device called Linear, as mentioned in the Journal of Clinical Trials, employs this method. It stimulates the auditory pathway with sound and the somatosensory nerves, often in the tongue or neck, simultaneously. This dual stimulation aims to promote changes in the brain's perception of tinnitus. Clinical trials have shown promising results, indicating a reduction in the severity of tinnitus symptoms. The third modern treatment on our list is tailored sound therapy. This method involves creating soundscapes tailored to an individual's specific tinnitus profile. Using advanced algorithms, the tinnitus sound and frequency are analyzed to create a customized sound mask or therapy sound. This can be delivered through specialized devices or hearing aids. The American Academy of Audiology notes this as a more targeted and potentially more effective approach than generic sound therapies. Next, we have Tinnitus Pillows. These are not your average pillows. They come equipped with built-in speakers to deliver sound therapy while you sleep. They play white noise, nature sounds, or other therapeutic sounds to help mask tinnitus at night. The Journal of Sleep Research highlights their role in improving sleep quality for those with tinnitus. This non-invasive and comfortable approach provides a practical way to manage tinnitus, especially during sleep. Recent developments include cognitive behavioral therapy, CBT, as being effective in changing the emotional response to tinnitus. Apps like Resound Tinnitus Relief, Tinnitus Therapy Pro, Belltone Tinnitus Calmer, Wiser, Sanvello, and Mindshift CBT offer practical tools for managing tinnitus-related stress through relaxation techniques and exercises. They help in changing negative thought patterns related to tinnitus, reducing stress, and improving coping strategies. Each of these therapies offers a unique approach to managing tinnitus, and their effectiveness can vary between individuals. Patients need to consult with healthcare professionals to determine the most suitable treatment based on their specific conditions and needs. Additionally, as research continues, we can expect further advancements and refined approaches in the treatment of tinnitus. The journey from traditional to modern tinnitus treatments reflects the medical community's commitment to evolving and improving patient care. While traditional methods continue to be valuable, the advent of new technologies and therapies offers a more diverse and potentially effective array of options for tinnitus sufferers. As research progresses, the hope for more definitive treatments for tinnitus grows, signaling a brighter future for those affected by this challenging condition. Remember, if you're dealing with tinnitus, you're not alone. There are a variety of options out there, so consult your doctor or audiologist for personalized treatment. This content is provided for informational purposes only and is not intended as medical advice. Tinnitus and its treatment can vary greatly among individuals, and the effectiveness of the mentioned therapies may differ based on personal health conditions. While efforts have been made to use up-to-date and reliable sources, medical knowledge is constantly evolving. Therefore, always consult with a healthcare professional for diagnosis and treatment tailored to your specific medical needs. If you found this content on tinnitus therapies insightful and helpful, please consider showing your support. A simple click on the like button goes a long way. And don't forget to hit subscribe for more updates and informative content like this. Subscribing helps you stay informed on the latest in health and wellness, and your support motivates us to keep delivering quality information. Thank you for watching, and looking forward to bringing you more helpful content.